A group of us has put together an organization called Chronic Care International, and CCI, Chronic Care International, has one fundamental objective. We are trying to find solutions for the problems of chronic disease in the developing world. Historically, in poorer countries, what we've really focused on is infectious disease, maternal child care, tuberculosis, malaria, diarrhea, HIV. And the reality is that internationally we've had great success with these things, and so now much of the population, instead of dying at a younger age, is growing to an age where they can develop diabetes or high blood pressure and the complications of those diseases, which are heart attacks, strokes, blindness, losing legs, and kidney failure. And it's a new challenge because chronic disease implies that these are things that you can't treat with a 10-day course of antibiotics, but really require a lifelong walk with patients so that they take the correct medications and they have the correct laboratory testing, they go to their doctor, and people have to change their lifestyles. And so it's a whole new problem that the developing world isn't ready to tackle, and we're excited to kind of get into with regards to helping find solutions. And our belief is that there are solutions. That belief that there are solutions is fueled a little bit by data that we have from our program over the last 5 years. When we talk about diabetes, there's a number of things that we can track to say, are we helping these people stay healthier or not? One of those is a test called the A1C test. And the A1C test basically tells us the truth of diabetes for a patient. Over the last 3 months, how has your diabetes control been? And so in the program that we have in the Dominican Republic, which includes 2 clinics, 3 physicians, about 8 health promoters, and 2 nurses, and 800 patients, what we do is at the clinics we check patients' A1C on a regular basis, and we track that electronically through a data system. And what we've found is that at the beginning of our program, the control rate for diabetes was very poor, where patients only about half the time had a level that we would say is in a relatively safe range, and half of patients were living at levels that were very harmful to their body in the long term. And what we've seen is over time, tracking that we've gone from that 50% control rate in a 3-year period, took that to about an 81% control rate, which is similar to what is accomplished with poorer populations in the United States. So it's a very exciting result, and the ability to answer the question, can you control chronic diseases in the developing world at an inexpensive cost, has been a fun one to answer, and really sets us up for, okay, now that we know we can do it, what next steps to bring that to more people. The second disease, which we've tracked in a similar fashion, is high blood pressure. And with high blood pressure, we generally say that people should have a blood pressure under 140/90. And when we started tracking that problem amongst our population of patients, what we found was just 1 in 10 had a blood pressure controlled to that level. So 90% of people were living with blood pressures at levels that were setting them up for heart attacks and strokes. Over the course of that same 3-year period, we saw that number improve to 56% control. And since we stopped that 3-year period and continued to track, we're actually up more in the 60% range, which is also very similar to what we're able to accomplish with poorer populations in the United States with more resources. So with the challenge of chronic disease, the first question for us has been, can you, in a developing environment which has lots of barriers, do a better job? And the answer from our 3 years of experience of tracking data is absolutely.